priorities for the EU. So I give it a second try. Welcome everybody today in the morning to our session, Health Priorities for the EU, launching a public debate on health in 2024 and beyond. And the rationale for this session, which is co-organized between the European Commission and the Observatory, is very, very simple. Next year, we will have European elections, we will have a new European Parliament and a new Commission. And what are we going to do about health and health system? And of course, a lot has been achieved, but will we be able to retain these achievements? Probably, but we need to discuss it, and how do we do this? Or will we forget the lessons learned? Will we retract some of the achievements? Will we go back? Probably none of the people here in the room want this, but we need to talk how to avoid this. Or do we want to go beyond? Many people think European Health Union has been achieved, which is really great, but maybe we want to go beyond and emphasize further issues where the European Union can add value. Good morning, Sandra Galina, and welcome to our... So the thing is that today with this workshop, we want to launch a public debate. We want to introduce this debate, and it will be followed up by webinars, seminars, a poll, and probably a summit workshop. And we want to collect what your thinking is. We want to probe, we want to understand what's the appetite actually, and where do you see issues, priorities, where the European Union can really add value. We start with a little bit of a poll. James, can you please launch the poll? We have predefined 9 themes. These are not priorities. These are themes which help us to guide a little bit the discussion, which hopefully you can relate to, but maybe not. Maybe you say there are additional themes, and which give us a little bit the opportunity to structure the debate. The first, of course, health security, very clear, very important. Nobody can deny it after COVID-19, but it's not just virus. It can be many things where we need to enhance our health systems for health security, bioterrorism, for example, floodings, migrants, and so on. Addressing the determinants of health through health in all policies and health for all policies. There are so many issues, which need to be addressed, and we are having policies which are detrimental to health or which are not helping us. And also, at the same time, we believe that health system can make a contribution to other policies. Supporting health systems transformation. Aren't our reforms really very slow, sluggish? We make little progress. We all want to move towards primary health care. We want to strengthen, the patient-centeredness, and still it takes so long. So how can we actually move on quicker? And what could be the role of the European Union to help us in this? Enhancing the labor market for health and care workers. We all know we have a health workforce crisis. And we have a European health labor market, but is it really working to the needs of health systems and patients? I think we can still tweak a little bit and get better outcomes. Achieving universal health coverage, it's in a way the hallmark of Europe, that's what we all want to do. It's a social model of Europe, and still there are gaps, and we are not even quite sure where the gaps are. We need to monitor, where are the populations that are not covered? Where are the services that are not delivered, Where is the financial support missing for taking this? Implementing digital solutions and artificial intelligence, it's a topic we are currently talking about all the time, and we see the exponential growth in innovations. We see that we have more and more awareness, but what do we do about it? Do we need to regulate? Do we need to inform? What do we need to do about it? And probably we need to do it together, actually. And what could be the role of Europe? Improving the performance and resilience of health system. I think most governments really are thriving to improve the performance of health system, better outcome, better patient experience, better access to it. And as it is now, my colleague Dimi, for example, together with Nicole and Nick, they have brought together all the instruments which are currently available actually to help support health systems development and performance, and probably this is another route which we can further pursue. And last but not least, addressing challenges such as aging and climate change. Seems strange that this is lumped together, but these are things which are not going away. These are things which are here for a very, very long time. They build the very condition of health policy making in Europe, and we need to continue to tackle them. So these are the 9 topics we have prepared. As I said, it's more a framework. It's not kind of prescriptive, you know. We want just to give you a little bit of an idea, you know, what the topics could be. We've also prepared some briefings papers so that there's basic factual information on these topics. We will show the QR code to access these papers later on. And we hope that these briefing papers will support the debate we will have over the coming weeks and months. So, James, can I ask you to start the poll? And this would then be, and the poll is about the priorities. Which are the priorities you find most important, the themes? James? Well, we'll see. Okay, we are already starting here. That went really, really quick. But before we go into the details, I would like to introduce Juan and Luis. We had yesterday a session with the younger Steiners, and we didn't show all these topics, you know. We wanted to have an open discussion on what could be the priorities, what are the ideas of the younger generation about Europe. And we had a very interesting game, actually, you know. You were exchanging, identifying, and ranking different options, and we would like to hear a little bit from your experience, you know, what was the outcomes, what kind of messages you take from it, and also what would you like to convey to Sandra Galina. Welcome, Sandra.
Thank you, sorry I was late.
Please, Luis, you start.
Thank you very much. I hope you can all hear me fine. So as said, Juan and myself will report back from a brainstorming session that we had with all young Gasteинers here yesterday. I think the broadest message that we want to convey is that the European Health Union has been achieved. Now we must build on it. So there are 3 large categories or topics that were on the screen before that we'd like to touch on with Juan today. The first one is health system transformation. The second, healthcare workforce. And the third, health in all policies and health determinants. So I'll just kickstart the first one on health system transformation. Really key words that kept on coming was the word prevention. It is something that we have talked about. It is something that we need to continue talking about. Our healthcare systems need to be a prevention-centered healthcare system as opposed to a disease-centered healthcare system. What we're notably missing in there are actions, activities around prevention in educational settings, such as schools. The earlier we start talking about these things with the young generation, the better we will be able to integrate prevention into our health systems.
Luis, Juan, before you come in, Luis, can I ask you something? When you were discussing with the other young Gasteiners these priorities, was it okay, let's discuss priorities again as we always do, or was there some enthusiasm, some appetite for it actually? Did you feel, oh, that's an exercise we really need to do, let's engage in the public debate?
Yes, definitely. There was a lot of excitement in the room, and we'll get to it later on as well, but involving young people in these discussions to see what should be the priorities, because I do believe that we all work to make the world a better place for tomorrow, and the tomorrow is us. So listening to us in these debates is absolutely being appreciated, and we're very happy to be able to convey our messages.
So you will need to help us over the next couple of weeks and months to inspire other people to engage really in this sort of debate. Juan, please, your impressions from the Young Gasteiners meeting.
Yes, so it was a pretty engaging workshop, and I think Young Gasteiners were very excited to have a voice in this matter. And they even had some a bit more controversial ideas, I would say, even regarding the better financing of public health systems. So one of the ideas that popped out yesterday was relating to the idea of having an EU tax on super profits and polluting businesses that could maybe finance our health expenditure.
Thank you so much. Louise, please.
I'm going to move on. We're still in the same category of health systems transformation. We see that we have quite a lot of unmet care needs, but to be able to address these unmet care needs, we first need to identify what these are. So we'd like to propose to have more EU involvement and EU support in monitoring the gaps at European level. So that's monitoring the gaps of unmet care needs, monitoring the access to pharmaceuticals and medical devices, and monitoring the needs of the workforce, because the workforce is at the center of any of our healthcare system, and we cannot do anything without them.
One of the interesting results, actually, I thought, coming from this little exercise, these are the results from the Young Gastiners yesterday, was that digital solution and artificial intelligence didn't receive many votes. But the reason behind is, it was cross-cutting. You found it almost in all the other topics, which is an interesting result in its own. It doesn't relate to you as a standalone topic, but you see how important it is throughout all the different topics. Please, Juan.
Yes, definitely. And as Luis was saying, the workforce needs was a big topic. And so the second big topic we are going to talk about is the health workforce labor market. And indeed, we focused a lot yesterday, our conversation on workforce retention. Not only the salary value of for medical professionals in some countries, but also improving working conditions, quality of life. And we even had some actionable ideas like protected research time or study time for these professionals. And there was a big focus on not leaving out other types of health professionals. So there's medical doctors, nurses, but there should also be a focus on long-term care, informal care, and other types of care that are important for us.
It sounds to me pretty much what we all are discussing. I don't feel at the moment that there's a big gender or generation gap, you know, that you are thinking about it so different from what we are thinking, you know. James, can we probably see for a minute the poll from the audience today so that we can see a couple of differences? So, addressing challenges such as aging and climate change is top priority, apparently, improving the performance of health systems. Well, addressing the determinants of health through health in all policies and health for all policies, supporting health systems transformation. There are some differences, clearly, you know, but again, for example, digital and artificial intelligence is rather lower ranked. Thank you so much. Luis, please, one more.
Yes, one more. So actually I see here that addressing challenges such as aging or climate change is big up here. I think that's another one of these more cross-cutting issues that we see in you know, many other sectors and topics as well, notably in the healthcare workforce. So Juan just talked about healthcare workforce retention, but there's also a big topic around healthcare workforce training. We not only need to have the size of the workforce that is large enough, but also that the workforce needs to be trained well to be able to address these challenges, such as aging, for example, because you know, we have this ever-growing challenge of the elderly population that will quite significantly outgrow us when, in not too long. So. But at the same time, historically, we've seen that the size of the healthcare workforce hasn't been large enough, putting a strain and a burden on the workforce that we do have. But at the same time, member states often do not put the resources and investment into training more healthcare professionals so that we grow the spaces. So that's one part, and what we also discussed with the Young Gastiners is that we need to have a sort of a forecasting of the needs of a healthcare system in terms of workforce that takes into consideration the cross-border movement of the workforce, but also that some of the workforce leaves the health sector to go work in other sectors. So really this forecasting exercise to see what the needs are to guide member states in having a larger workforce.
Thanks a lot, Louise. And I think the health workforce is one of the difficult nuts to crack, also because in some areas, Europe has a lot of competencies, and in others, the competencies are actually very limited. And of course, there's still opportunity for support, like, for example, with science, with monitoring, and stuff like this. But we need to see during the debate where the real added value, where the real niche is actually in some cases. Sandra, can I ask you? You heard the voices from the young people, the instant reactions. What's your impression if you hear them speaking about the priorities?
Well, I would like to start that it's good to average out the age here, given that we have as one of the top. Is this working? If it is red? Yeah. Okay. So I was saying, given that the first topic is aging, it's good I average out, otherwise, here we're out of topic today. May I start by thanking all of you for being here and for inviting me. I was told by someone who is very close in my working entourage, once a Gasteiner, always a Gasteiner. I was laughing a bit when I first heard that. But it is true. It is a very, I would say it's exciting experience in all respects to see also very committed young people for the future. So let me say to you, I just come from a press conference where Hans Kluge, my dearest friend Hans, was quoting very, very good figures about young generations. He was giving age brackets and all for his survey, but let me say that 75% were worried about the future for health and climate. So it's clear that it's a concern for all of you. And then he was quoting a more aberrant number, like 83% of the people in a very young age bracket think that we have not done enough for the planet, in a sense, to also help, and in ultima ratio also health. So very good to see you all very committed. We want to listen. This is a very good experience because I had another one which was more officialized. It's called Citizens Panels. It was an idea launched in the previous States of the Union by the President. I was the first to do a citizen panel on food waste, and it's very good to have the direct input of people. So you were right in saying that you don't see much of a difference here, and this is, I admit to you, but what I think is the nuance is slightly different. This thing that you say people see digital as interwoven to other parts is very interesting because it should be so. You know that when I arrived in this file, I had some discussions with the people who were doing digital in my DG. Please don't quote me totally, but it was like in the privacy of this room, I was feeling that they were being digitalized whilst they wanted health to be the prevailing topic in the mixture. At the end of the day, it was just so lucky that I had this fantastic Director-General, Roberto Viola, with whom we get along very well, and we are doing fantastic things. So we are a big family between DG Connect and DG SANTE. We are doing things seamlessly, because when you have multidisciplinary topics, we will see also with climate, there is also this thing where someone ends and where the other begins. It's unfortunate, but it's the silo mentality, whilst this should be banned. Because, you know, for climate, the climate benefits also from a decarbonization of hospitals. On the other hand, better climate means fewer pressure on hospitals. Now, I want to counter a few things that I see here. First of all, it's not that before COVID there was nothing, or that before COVID people were not thinking of things, because I pick up a bit that topic in what we come across, even in the... No, we were doing things, perhaps, you know, the fact that we got a big blob of money, 5.4 billion all of a sudden for EU for health, put some batteries in our brains, because we need to use that money. The problem is that, in my view, if you go through the calls of HADEA, the absorption capacity is quite complex, because this field, let me say this, the public stakeholders like NGOs and all have not developed the ability to spend huge amounts of money. So let me say a call in this public forum is professionalization, and using all the money is the best thing we can have, because many of these topics is only with you that we can drive.
Sandra, Joseph is getting nervous because I think he's...
Yes, I see you nervous, but I want to say a few things, because I want to be on the... Now, I want to be on the record on a few things so that you don't then claim no responsibility. There is not only EU for Health, there is a lot of money that is being put by the European Union in health systems. Why do I say this? Because I'm just back from the US where I see a system I don't want. We need to make our systems resilient and sustainable so that they can cope with the pressures of the future. So if you look at, I would say, big numbers of the RRF, the Recovery and Resilience Fund or facility, 40 billion. If you look at 16 billion that are put by cohesion funds, you need to, as young people, believe that we're putting the money where it needs to be. Then it needs to be spent well, and here it's your duty to watch about that in the member states. So climate, aging, yes, very good. I saw a few other topics that are in our agenda. What the next agenda will contain, I cannot prejudge because it will be the choice of a president and of a commissioner, but definitely these are topics we're thinking about, and not because, you know, it appears interesting, but because you are asking for these topics.
Thank you so much, Sandra. Juan, I guess, will you stay connected? Will you contribute to the debate? Are you planning to do this?
Yes, of course. We are very happy about this workshop and this initiative we had yesterday. And we actually think the Young Gastein program and the EHFG is a good example of including young voices in the discussion and in the debate. And
excellent.
So, yeah, here we are.
Luis, final quick contribution from your side.
Ooh, quick one. No, I think it's one thing that we haven't touched on with Juan, but Sandra very well touched on it, is the climate aspect. I think as a young generation, you know, not only speaking for us young professionals in the healthcare sector, but young professionals or young people in general, climate change is something that we need to talk about. And making sure that healthcare policies, you know, are embedded in that and respect that will be very, very important. So that's a quick one.
So a big applause for our two young Gasteiners. Thank you so much for helping us starting the launch, actually, of the public debate and getting really engaged. And now I hand over to Joseph Figueres. Joseph Figueres.
When you say my name,
sorry.
Please. Can I invite, please, Martin McKee, Professor on the School of Hygiene and Tropical Medicine, and Caroline Costongs, please join Sandra, and Caroline Costongs, Director of EuroHealth.net. Because we want you. One of the big privileges today is to have you, Sandra, today with us. So let me remind you, this is exciting. I know, I will say that, but this is exciting. We so lucky in the observatory that we had the opportunity to work, to start no consultations, a series of debates about the future of the European Health Union, future priorities. We're not going to write the letter to the Commissioner, right? Yesterday we're suggesting maybe ChatGPT should do that. What do you think, Sandra? Should we ask ChatGPT to... Seriously, we're gonna be working with you. We're starting Gastein. Thank you, Gastein. Thank you, Clemens, Dorley. As opening this initiative, I started with young Gasteiners. The workshop now, the senior policy dialogue later on, will be starting this process about priorities for the future Commission for the European Health Union. Remind you, if I can have back the results of the poll, that these are areas. The devil is in the detail. The devil is how far can we go. I liked your idea, and I like to hear the things. Can I see the poll, please? The things you didn't put. You just showed us the poll on what you coincided with our ideas, but I love the idea. Maybe I can ask you in a minute, Sandra. Tax in companies to support health. Remember that idea as well on tax on market transactions to support health. Why not? We need to go there. We have the right to go there. We have the right and the duty to be visionary. So if I can see the poll, please. So we're starting this process that I hope, I know DG SANTE will pay some attention. It's a process by which in various fora we'll be consulting you. We'll have several webinars and so on. Number two, what I want to do now, Sandra, is to continue with the points you're making already. with the three of you. I'll ask you some prepared questions, but I'm going to drop them, and I'm going to start new ones, because otherwise it's too boring. You are too prepared, and none of you want to do that. And more importantly, I'd like you to start a debate between yourselves. You are three people. You never have a problem having a debate on this area. So let's start with Sandra. Sandra, you already told us a bit how you felt about those. In my view, see whether you agree, there are three groupings that you all agree, the young Gasteiners and the oldish Gasteiners here. I'm increasing the average age as well here, because otherwise there's age discrimination. So there is a convergence around both you and the oldish Gasteiners about climate change, clearly there, which I will, in my mind, put it with the health in all policies and health for all policies. At the end of the day, climate change is the ability of Sandra, and I'm very glad, Sandra, that you have this portfolio, because if there is, I'm not going to compare with anybody, but there is someone that comes from powerful portfolios like trade, you know the business, you're assertive very well, and you'll coincide with me that really is the same thing. It's how we bring health into the debate on climate. Us offering co-benefits, showing that we are good for climate, and empowering climate to show they're good for us. So there is a block there. The second block, which I see together, is the performance of the health system and transformation. Transformation is as important as benchmarking, as indicators, as assessment. How do we make change? So to me, it's the second block I'd like you to please reflect on. And the third one is around coverage, that the younger science agreed. And interesting, you brought the health workforce. We'll have, and which is here as well, the health workforce and coverage would be the next ones. But of course, again, what kinds of policies we can put in place. Sandra, briefly, and then what I want to do with Matthias is bring you in if you are short and sharp and quick. Yeah, so we bring you very quickly in the debate, so we have the great opportunity to have Sandra and colleagues here to respond. Following from your first reflections, let's look, you said it, there was life before COVID, right? So it's AC/BC, you know, I like to talk about AC after COVID, before COVID. There was life, and I was around, and you were around, and many of us were around before COVID. Lots of things happened before COVID, lots of things happened with COVID. As you look at the future, which ones of these great achievements you think will be more important to build that future? You already talked about more money. It's important. I don't know how the more money is going to last. Do you count for so many billion for the next EU for health?
Well, this is why I'm pleading for good expenditure. Unless it's spent well, the money will not come into the kitty. That's the reason.
I think that's fundamental.
You need to help me spend it well, and when it's spent well, the Parliament and the Council, the two budgetary authorities, will be only too happy to give us further access to funds. But this is why I'm quoting the absorption capacity, unless we have, and you cannot improvise that. If you have a very small group of people and then you have 10 buses passing, there will be one bus that will be quasi, filled, not full, and then the others will go empty. So this is very, very important, is a plea that I make. But let us go back to the more broader thing, not zooming. So you mentioned climate transformation and so on and so forth. May I say to you, it's very good we all, I think as individuals, bear in mind that there was a time before COVID and a time after COVID. And I'm very happy to have here Martin and Caroline, because they both, I think, have experienced the groundswell of, I would say, needs of health and public health, which is a very important domain which is taken for granted. I discovered that many people don't even know very well what public health is. They lump it with things which have nothing to do. So it's good that it became clear that it's not necessarily epidemiology. Public health is something different. So there was a paradigm shift. People started to believe a bit more into the words investing in health. Health is not a cost, but is an investment. Now, not all believe in it still, but I believe that a fair share of my actors around me meaning the people that in the end decide, because you need to have a law and you need to have money. These are the two things that in the EU we discover is crucial. We had this morning a minister referring to this.
Yeah.
The paradigm shift. So there are many issues I would like to tackle with a young audience. First of all, how do we finance our health systems? And why do I go there? Because I would like to preserve the good. I have nothing about private health. It's fantastic. It offers fantastic, I would say, it has an ability to really offer high quality solutions at all moments. And on the contrary, I think it's very complementary. But we need to protect the public health system for a simple reason that is not so much here, and I'm a bit worried, is the equity. You have not all the same pockets, and with different pockets you have different treatments unless you have a public, I would say,
But let me put you there, Sandra.
Yes.
This is about what you're doing about the European Health Union. We all agree in equity. What can you do specifically from SANTE, from the European Union?
This I want
That's
to
what
come.
I like.
This
we want
is where,
us to hear.
and you know, I'm very operational.
What do you need from these people to support you?
I'm very operational.
Sorry.
So I'm very operational. There is a whole set of issues that you will need to propel in your own national systems, for which I don't have competence. Whether you go for a beverage system or other systems of financing your public systems, that is a citizen's choice. Citizens are always right because they vote. So you choose how to finance your public systems. But me, indirectly, when I try to improve, let's take it from very far, improve prevention with Healthier Together, or all the actions that we are undertaking jointly. When we're trying to exchange better practices, we are lowering the pressure on the health systems, including on hospitals. So we're doing a tiny fraction, and it needs to be European because, let me say, one member state does not have the best recipe. It needs to be collectivized. Secondly, we have a huge, I would say, set of chantier, as I say, building sites. The building sites always will try to propel an idea of equity. I might take the human substance, I would say, discussions at the moment. That legislation is vital. There is an issue of dependence of the EU for many of the human-derived substances, including blood. This needs to be also dealt with ethical part of our mind. We go further into another building site where there is the digitalization, and digitalization has a lot to offer to citizens, provided citizens feel that they can trust. So when you give digital is not only, I would say, economics going down, costing less, but it's also better treatment. Finally,
and equalization? Because one of the big debates in Gastein, and I'm sure in the room is already, I feel it, is digital equalizing. Are you, one point, you cannot say that, I can say it, Sandra. The other day with the minister, I said, you will go to Sandra in few years and beg for regulating of AI because none of the member states alone will be able to look at algorithms because there'll be lots of biases and will affect vulnerables. Will you do that when they ask you?
If they ask me, we are certainly ready. I tell you that I mentioned Roberto Viola not by chance because we know about this AI divide almost in societies where we need to really be very careful. AI needs to be used for the good of people. It's a long debate, we will not go there today, but it's very good what you say because we experienced it already, and if you want, we are totally today, the Digital Services Act is entering into force. It was a huge monumental battle. We are Europe. We are not the US, we are not China, we are Europe. Citizens want their data protected. It's a different approach. So we will go there if we are told to go there. I mean, I'm simply a bureaucrat. I finish with the last big building site because this is a sense of equity. So I cannot deal with your systems and how you finance them, but I can certainly have some indirect influence with the medicines. So a reform of the legislation of medicines so that this cake, which will not be increasing, the cake of how you spend money on medicines both for outpatients, inpatients, will not change monumentally because, I wish we could use money and print it, but, that is not a good recipe. So in the end, we need to see how we distribute the cake between, of course, the originators, of course, I would say the generics, but also biosimilars. There is a bit of a discussion to be had there, and I can see that there is a growing biotech divide between, I would say, what we do, others do, so we need to think cleverly. There are also their issues.
And other technologies, perhaps, Sandra. I'm dreaming that one day, perhaps, all your work on pharmaceuticals could go into other technologies and innovations, and in that sense, the EU can be an equalizer.
Yes.
But let me go to Caroline. Caroline, we are going, Sandra preempted you, and rightly so. You're a happy, happy person. I can see your smile. So when the Director-General says equity matters, you must be very happy. However, the Director-General cannot say she has to abide to subsidiarity. You and I do not have to. What else could the Director-General and the EU? Cohesion funds, pillar, I hear all these things, European reference networks, funds to pay for services across the region. Let's kill the cross-border directive, and I know, Sandra, I know. I need to provoke you a bit. And let's get people to cross borders and get services across Europe. What do you suggest? Don't tell me equity is important because we are converted here. What do we do in the next commission, in that letter to the commissioner by the president?
Yes, equity is important, and I just wanted to say that indeed equity between countries is huge. It's 9 life expectancy years between Latvia and Sweden, and the healthy life expectancy is even 18 years. So it's really big topic for SANTE to address, not only for SANTE, but for the whole of the Commission, because inequalities, is fueling anger in society, social unrest, is not going in the right direction. So health inequalities and inequalities in various European Union policies is really important to address. So what can be done? I think in SANTE it would be good if monitoring health inequalities as a standard feature in State of the Health of the Union is important. There is already the inequalities registry for cancer, but that's only cancer, and it would be good if that can be broadened up. But also the EU for Health program, equity is supposed to be one of the core objectives, but who is monitoring that? Is this indeed happening? So it would be good if SANTE can step up a bit there. If we look at funds, indeed the cohesion funds is there to address inequalities, geographical inequalities. So
are there enough? Are we using them well?
Well, there's the European Social Fund.
Reminding us. Are we using them well?
Well, it is, yes, we have been looking at the European Social Fund. The European Social Fund is used for health and for reforming health systems, so for health and social inclusion, health inequalities, but it is not very prominent there. And I think we can raise the prominence of health in the European Social Fund, in the Just Transition Fund, in the structural funds. So I think there is definitely an opportunity there. And then with the European Pillar of Social Rights, with the 20
You know how many years I heard about the pillar?
Yes.
Can we ever make them count? Can we legislate one day before I retire? I'm retiring soon.
Yeah, there is an action plan on the pillar, and I hope we will continue to hear many more years of the European Pillar of Social Rights, because I feel that the pillar is the compass, our social compass for the future. And the pillar has one principle on health and access to healthcare and preventative care as well. And I think that SANTE can use that principle to stimulate debates, to bring member states together, and to see also how, for example, the cohesion funds can be used to implement that particular pillar on health. It is a tool, I would say, to take discussions forward. But another very interesting feature of instrument is the European Child Guarantee. Because the European Child Guarantee is, in fact, an instrument that brings together various policy areas. It is to give every child the right for safe and quality housing, nutrition, quality education, health, leisure activities. And the pillar of the child guarantee is also embedded in funds, and member states are, well, almost all of them have now completed their national action plans. And what is important is that we, as a public health community, make use of these instruments, but also in DG SANTE. So if we talk about health and all policies, then I wonder, and to what extent the officials working in DG SANTE are indeed proactively working with other DGs to take those opportunities and to advance health further.
Perfect, thank you. Sandra, I want to, let me get another provocateur, a agent provocateur here, you know well, Martin, on this one. Because Sandra, one day you told me, and I see that, you said, Joseph, I can go to the other sectors, I know them well, I can do health impact assessment, I can shape them. Before you tell me that again, and which I believe on, Martin, today we were together there, we had the breakfast with the minister, talking about health promotion, Caroline, you were there as well, and we talked about the commercial determinants. The Commission, the EU, is what in a textbook would say, a health in all policies and health for all policies organization. It's ideal, it's my dream, basically. Are we using that? Has, Martin, the COVID and the post-COVID and the fact that we are in the big league now, we're about sustainability, we're cohesion, we're security, health, thanks to COVID, can we use that to go, to me, the commercial determinants of health are bigger public goods than the viruses. Bigger public goods than the viruses. What can we do, Martin?
So the first thing...
Towards the future, not what...
Yeah.
I don't want to hear all of the things that work badly, the things that work well, and how we build on those for the future. Sorry, Martin.
So the first thing is that the commercial determinants of health are positive and negative. And there are things that the private sector does that contribute positively to health. And we have the pharmaceutical and medical technology industry in the room here.
Yeah.
And many of the things they do contribute to health, not all of them. And as I've often said, my personal relationship as a public health doctor with the pharmaceutical industry, it's like a Venn diagram. There's an area of overlap where our interests are shared. However, we know that there's been malpractice and other things where they're not shared. So we need to maximize the areas where we can work together. That said, as we set out very clearly in the report of the Pan-European Commission on Health and Sustainable Development, which Mario Monti chaired and I wrote the evidence review for, edited the evidence review, we set out that there are many people, many organizations who see people around here not as citizens, but as customers. People to be basically profit sources. And if they're providing things that are genuinely needed and improve well-being, that's great, but often the things they produce, tobacco, alcohol, gambling, which is a big issue that is really not being addressed adequately, then we need to start doing something. So what can the Commission do about all of this? Well, it's really, really difficult because in a way the Commission is like a national government. There are different interests sitting around the cabinet table, there are different interests, and I think, the challenge, of course, is to really keep making the case for health. That's the first thing. We've now got the
But what about legislation? There's all these legislation initiatives.
Well, what I'm going to suggest is...
Can we step those up? And Sandra, I'll come back to you on that.
The first thing I'm going to say is that we need to make the invisible visible, because most of what these organizations do, not just the companies, but the think tanks. In the UK, we have 55 Tufton Street, notorious as a base for many of these groups, funded mostly from the United States, and who are conspiring to undermine health. And we need to take them on. And we need to take them on by conducting the research that the tobacco research community did so effectively with the master settlement, getting the internal industry documents, which people are doing with food, we're doing with gambling and others, to try to show what tactics are being used.
And
then the Commission can do,
that?
yes, the Commission can, of course, support that through Horizon Europe. But the other thing that it can do, and has been, and you know, we've been looking at, has been whenever you get consultations on issues, not just to, I mean, what do? You get thousands of responses to consultations on these issues. And you sort of put them all in a hat and you have to make sense of them. First of all, AI can certainly help with that. But we now need to start doing what we did, for example, on the EU Tobacco Products Directive, what one of my my PhD students, happens to work for the Commission, did in a very nice study looking at acrylamide, the consultation on acrylamide, to use the tools we now have like quantitative text analysis to map the positions quantitatively and then to do discourse analysis, because so much of this is about the way in which these vested interests frame things.
Perfect.
The gambling industry pushed the idea that gambling is fun. No, it's misery, actually.
So we expose them.
We expose them.
Can we convince the college that Sandra is working with in exposing them and then passing the kinds of legislation. And you have great initiatives underway, sort of on the commercial determinants, on child advertising, on labeling, and so on. Why they don't go faster? Martin, and then you, Sandra, and then I'm coming back to you in a minute, okay? I'm coming back to you in a minute. Clemens, I think you want to speak.
Yeah, so a few things. Why, sure.
Microphone.
Yeah, microphone. Yes, always my blind microphone. So, why don't they go faster? Well, you know, the issue has been that this mandate has been lumped with this COVID thing, and let me say to you, we were expecting to do things on AMR, on EHDS, on everything, but we were not expecting to have this big block at the beginning, and the whole DG was particularly stressed. On the issues that were mentioned, I would like to put a different spin in the sense that, of course, we can see it in this way, but we can also see DG SANTE per se is DG One Health. We start really from literally almost from the soil. The soil belongs to my colleague Florica in DG Environment, but let me say I have plants, I have animals, and I have humans.
Yeah.
And in fact, I have the aspects that go into the mix to produce, if not full well-being, at least a healthier society. So if this is politically appropriated, basically because there is also the political space. My commissioner was very interested in all the topics that we are mentioning, but let me say this mandate was about preparedness and getting that thing out of the way. Also internationally, we have been absorbed with that, and in the meantime, I would say the topics that Martin was quoting, I could see that internationally there wasn't that attraction. Now perhaps it will resurface. So we, as also an international voice, we will try to do what we are told to do, but it's clear that that agenda will not go away. So in a sense, without going in an extreme fashion, after all, I have my responsibilities, I must tell you, for us it is clear that we need a more holistic approach. Our DG has become a bit the fulcrum, so it's not how many of my colleagues go to other DGs, is how many colleagues come to our meetings. And I can tell you that we are very much polluted these days, also by decision of the Directorate-General. We are very open in our meetings because every one of my colleagues at the top, they want to participate in what we do because then they see that we have a very capillary impact. Health is very capillary. You know, financial markets may be fascinating as a topic, but it reaches a very small audience. When you talk about health, you're reaching the citizen. So, in my view, we have a good premise. We literally laid the foundations of a health union during this mandate. Let us see where the next mandate takes us. But without funds, I'm sorry to repeat that, we will not be out of the woods easily. So the choices will also need to go in a direction where we can be sustainable. And it's not because we don't want to spend, but because we want to spend well. It's
we need to make the case, value for money and so on.
Value for money,
perfect point. What I'm going to do now is I'm going to see some of the graphic representations, but Matthias and I, where's my colleague Matthias, the one coughing, what we're going to do with you now, if that's okay, is 30 seconds on the clock, going around the room, and not moaning, not telling you how wonderful your organizations are, because they are, but saying to Sandra and colleagues in this kind of debate, one measure that this commissioner should take in his or her letter, one way forward you heard, and not tell us something visionary towards the future, something with some pragmatism and realism, but visionary. That's what we want to hear, and if we are fast, Matthias and I, we can get lots of those points. But first, can I see the pictures that I think is the time according, oh my goodness. Wow. Who can help me to interpret all that? Healthcare market, I love it. Actually, I like to leave this here. Rather than the voting, I like us to have this one here, what we've done for the planet. That's a much better representation of voting. Well done. Beautiful piece of work. I love it. I'm going to plagiarize it and use it in my presentations, coming from Gachan, of course. So we have that. Matthias, now let's go. First. Should we go online first? Do you have anything to tell us, Nicole?
Yeah, sure. So the discussion has been warming up online and picking up some of the themes that the panel already discussed. In the interest of time, I will pick up two main themes. The first one is around available EU support and instruments, and how the EU can support member states with resilience and sustainability of health systems. So we heard that there are a lot of funding instruments available from EU for Health, Horizon, the cohesion policy funds, but how do we facilitate the effective and efficient use of these instruments? Could, for example, the RRF be a model for the development of funding instruments moving forward? And how do we show that it has had an impact on health systems? And how do we make the case to decision makers that such funds are necessary? And then secondly, can the EU support member states with measuring whether health systems are resilient and sustainable? Should we look to other sectors, like the financial sector? Should we have something like a banking stress test for health systems? Recommendations in this direction have already been made by the Monti Commission, which Martin already mentioned. So should we look to other sectors on how to deal with stresses? And finally, the audience was interested in the Younger Steiners discussion and which other priorities were raised, because there was a large number of priorities which were not in the framework we discussed. So if we could hear about that a little bit.
Thank you. I like your opinions at the very end, and tell us all these things that you didn't dare to put on the table, but probably were much more interesting. Number one, on the tools, Nicole, I'm sure you prepared this question. You with Dimi Pantelli and Nick Fach have been preparing this wonderful piece of work about all the existing tools, but we want to hear more. Sandra, you said that effectiveness, value for money, value for money. Very briefly. So be ready for what you hear from the floor. I want to push you further on health in all policies. 30 seconds.
I have here already the first
30
one.
30 seconds.
Please, Andrea, introduce yourself and just very...
Can I ask a question?
No, not a question, a suggestion.
Okay, suggestion. Yeah, the suggestion would be to include health in all climate policies de facto, and really have also programs that make it obligatory to have health in all the climate programs of the European Union there.
Thanks a lot, Andrea. Very brief, just a suggestion.
Thank you.
But how, Sandra, how?
My name is Elisabeth Campestrini and I work with countries in transition. And I would like to suggest that countries in transition aiming to accede to the European Union should see the same standards fulfilled that you are discussing here, and that the standards need a thorough discussion there. And second point, I totally agree with Professor McKee that private sector is important, but please do not forget that in these countries, the private sector is influenced by countries like Saudi Arabia and Turkey, and take that into consideration.
Thank you.
Your 30 seconds, Vesna.
Coming from Ministry of Health, I wouldn't do anything in my career if it wasn't for civil society supporting me. They need money to operate, not just money for projects. So make sure that there is money available so that DG SANTE will be able to implement. Thank you very much.
Yes, very good. One over here.
Yes, hi, I'm Yaisa Rivero, Head of Prevention for Luxembourg. This is not a new indicator, but I think it's a good one, which is health-adjusted life expectancy. I think it shows how you put in place prevention and how you work on social determinants and many of the things that we've talked about earlier.
So it's about monitoring capacity improving.
I got one here.
Claudia Wild, Austrian Institute for Health Technology Assessment. My proposition is take the pharmaceutical legislation serious. It's about affordability and access and not strengthening pharmaceutical industry.
Not a question.
Excellent, very
One
clearly.
over here, Joseph.
Yes, I would suggest to include EU for Health and Team Europe together. This will really implement global health strategy.
Thank you.
Beautiful. Over here.
Johanna Grammers from AOP Health, and it's about positive incentives to strengthen clinical and pharmaceutical research in Europe.
Are you taking note? Anyone taking note? I was trying to do that. Are you doing that, Nicole? Taking note, yeah? Okay. Oh, well, well done. Maybe you can help me to moderate. That would be great.
Please taking health determinants just more and more serious as it is, and work extremely more on health equity that we need as a population. How? Just
Today
to make
is the
it,
how. It's the how day.
To take it more serious, to address it more, to make it more transparent, and of course to work on industry.
Joseph, we have one more here.
Please.
Hello, I would like to stress the thing about the affordability of medicines, and also include access to healthcare of undocumented migrants. I wonder, in the line of health in all policies, if this issue is included, because the new pact on asylum and migration, the impact on health, on the human rights for undocumented migrants is awful.
Thank you so much.
Shall we, Matthias, to ask our panelists to be as disciplined as the questions were and reflect on some of those? Can I add you a question, Sandra? I love the alcohol monopolies in the Scandinavian countries, and they are disappearing because of the politics. Can you say something about that? Well, you cannot say something, but maybe can you hint something about what you think? That's my question as well. Are you going to react now on the various questions, please? And very shortly and sharply, like they did, because we want another round, right, Matthias?
I think that we are all watching this space, and you know, let me say that it is also a matter for voters and citizens to take in their hands.
Democracy again.
Yeah, it's democracy, man. So on the very last issue, I have been taking notes on the very last issue. It is often the case that we have quite a lot of funds for the marginalized groups. We call them with a very appropriate diplomatic label, and they include, I would say, also the categories that have been quoted here. I have my colleague here, Isabel de la Mata, who has been, I would say, one of the most valiant colleagues trying to further those policies. Again, it's democracy. We could do certain things like distributing vaccines, just I quote that, to very marginalized sectors of society in some countries. It was more difficult in others. So, you know, we as the European Commission, we're definitely in that league. But at the same time, we have a member state whose competence is quite strong, and you know, we try to really reach every member state in an equanimous way. But then it's the member state choice.
Perfect. I'm not asking the panelists to answer all your questions. We are recording all those. We're gonna, it's part of this debate process. Sandra, you know, and colleagues, there was a statistic the other day, around 1/3 of our European populations are voting towards populist parties. Democracy. You want to pick one of those?
Yes, maybe also to respond, when we talk about health equity, it's not only about the marginalized groups. It's very, very important, but there is a social gradient. I mean, and there, you know, every step we go down the socioeconomic ladder, health is getting worse. So it's the group above that, and this is the group that moves to the populists and that are angry, and we need to make sure that they are on board. So I would like to just take this opportunity to say, and I listened to all of your comments, that I think the well-being economy is really a very interesting concept that was introduced by Finland. Actually, I think we should have a vice president on the well-being economy, because it's overseeing all of the other commissioners. We can use the European semester, which is a macroeconomic tool, to measure whether we are meeting the well-being economy vision. Then not only in financial capital, but also nature capital, social capital, human capital, cultural capital, and value them all, and use an alert mechanism. And this is actually proposed a time ago by Belgium and Spain and some other countries, to use an alert mechanism in the European semester. So if we go above some health indicators or social indicators or well-being indicators, that then there are alarm bells, and that is an opportunity to discuss with those member states that things go wrong, and with country-specific recommendations and with funding streams. I mean, it is a big tank, and it is really difficult to move this tank.
But what I like is the linking you're making to big politics and populism. Professor Greer was teaching me the other day that there's a lot of interesting evidence how equity, universal coverage, actually counteracts these populist movements. If we can explain to our policymakers, our politicians, that actually is good for their sustainability, it's good for their politics, I like that very, very much. Martin, colleagues, Juan, Luis, I'd like you to comment on that as well. I'm not leaving you behind.
So I'm deliberately, I'm deliberately not going to take an issue because every European meeting I've ever been at, including many in this hall, have comprised people standing up and saying, I represent people with disease X, or population Y, or I research condition Z. And that's really important. And then Sandra has the challenge of saying, you come out with a huge shopping list, as we've done today, of all of these issues, and then she's got to try and decide among them with all the other influences exactly. And the politicians have got to try to balance all of these issues. So that just encourages the silo mentality that we've been talking about so much. I want to see us coming up, and we did do in the Monti report, sorry for plugging it again, a comprehensive assessment of the threats to health and why they're important, and making the case for health, which we did do. And we looked for the planetary issues, the things that we can do nothing about, like asteroids, to the things we can, planetary health, climate change, desertification, and then all the issues that go from digital access to justice, to organized crime, whatever. Bring all of those together. And then if we do that, we've got a clear idea of where we want to be. Now, we talked about the global side. As you know, I have been rather critical of the global health strategy. Not that I think there's anything wrong with it. I think it's great. A paper that, and a shout out to Sam Field, one of the young Gastiners who co-authored our paper in the Lancet on this. I think it's a good start, but we needed a comprehensive vision in all of that. And then we can start to address these issues. And the argument on the Monti Commission that was most persuasive with the politicians, remember I had 2 former prime ministers, 3 former presidents, was the populist argument. We've done work looking at Weimar Germany, looking at Italy in 1918, and looking at the Brexit vote. It is very clear that people who are left behind are fertile ground for extremist, xenophobic, populist politicians. And we can make all the arguments about the economy. We do. We make the moral argument. We make the legal argument. It's all in our report. But it is that argument that for many politicians is most convincing. And then we can do, and again plugging it, all the things we advocated, making sure that health is in the Article 4 assessments by the IMF, making sure that when the international financial institutions come to a country, they don't criticize them as the IMF did in West Africa. Again, we showed how the IMF policies created the conditions that allowed Ebola to arise there, but instead will say, you're not spending enough on health, and because you're not spending enough on health, you are leaving your country vulnerable in the event of a pandemic. And if that had been done after Ebola, we maybe wouldn't be in the situation we're in now.
Yes, and I agree with the Monti report because I was involved, but also because I actually brought these kinds of issues international arena. And Sandra, with your global health report and the plans you have, clearly the EU as a light, as a key light on universal health coverage and equity. At the end of the day, we are the most highest coverage and highest equity continent, not far enough, Caroline, can play an important role in international arena. Can I have some reflections from you, please?
Yes, so following what Martin was referring about, showing other institutions and politicians the value of our policies and these health problems, and also answering the question from the audience. Another topic that was a bit out of the scope of the main categories that came out yesterday in our workshop was about health policy communication for citizens. So we know we have to do a lot of work to convince politicians and institutions about why healthcare and public health matters, but we also have a lot of work to do in convincing citizens that the policies that we want to implement or that we are implementing are actually good for them and that they understand them. And even after the pandemic, we've had a bit of a fatigue with the health messaging and a lot of mistrust in institutions. And there's a lot of work to be done in this area. So we need to make people understand what these health policies mean for them, as citizens, so we can then implement them.
Again, we're going back, Vesna, we're going back to the civil society, we're going back. Change can only go from the bottom up, civil society, population, democracy, and dealing with the big politics that everyone has been highlighting. Luis, any more radical, challenging, provoking points from the young Einsteiners yesterday?
Well, it's not that provoking, but it builds very much on what Juan was just saying. We really need to have this interlink with the regional, local level a lot more. We can do whichever policies we want, but if we don't explain them well through communication, and if we don't have this link with the locals that will at the end implement any sort of strategy or any sort of policy that we come up with, it's not going to work.
Why are we so lousy in communication in our field? I leave it just for all of you, apart from Martin McKee, Sandra and Caroline. Can I have some more views from you? Where is my colleague? Matthias, at the end, you will summarize 5 minutes with Sandra. Sandra will tell us whether she's happy, what she heard, whether she thinks, I hope she's going to say she's happy, that we are in a good starting for these debates. But let's get more and more points from the public. You go at the end and I stay here.
Anybody wants?
Anyone?
Yes, please.
Ewout, please.
Really get serious about collecting data around coverage, access and quality, because there are so many blind spots and we know how to improve it, and we really need to do that and get serious about it.
You prepared to benchmark member states? Will Sandra prepare to benchmark member states? Name and shame? We'll ask her later.
Just here first, yes, sir.
Sorry. Oh, I'm sorry.
Hi, David Earnshaw from MSD. Nobody's mentioned yet the need to assess the implications of enlargement, big issue in the next Commission. The European Union will increase its population by perhaps 10%, and it's a population with a particular health need. Lots of amputations, for example, coming out of war.
Thank you. Perfect. Vesna.
It's not always politicians that the public trusts most. But there are people who work with different groups of population and they trust them because they can see that they do something for them. And these are the ones that should communicate. So we have to support them, finance them, empower them more. Thank you.
Yeah, thank you. The trust and transformation will be the theme of the ministerial conference that WHO is organizing in Tallinn with the Observatory, and very much is building that trust, that co-production that Martin has been pushing, rightly so, between professionals, health workforce, and patients, and between different professionals.
We got one here.
Hello, everybody. I am from Czech Republic, Deputy Minister for Economics, and I would like to ask you how to deal with the problem. On one side, universal coverage, but on other side, these really very expensive new generic medicines, which can destroy any system. So I would appreciate that just the common attitude of the EU level. Thank you.
I think we need a separate session on that one. It's Q1, Sandra, right?
Here's one more. Michael, please stand up.
Yeah. Mihai Kökény from Hungary. So what about setting up or recommending minimum standards for health policy making and health systems in the member states? Thanks.
Like, you mean standards like numbers of doctors, nurses, or access waiting times?
Even funding of healthcare, government expenditures to be achieved, just recommending such certain benchmarks.
So that no country goes under the bar.
Michael, you were once a minister, I remember. Wouldn't you ask that to Sandra when you were a minister? Tell us, please. Would you ask that to Sandra as Minister of Health Hungary to get the Commission to give you standards? Please tell me that. I want to hear that. Just a yes or no?
Yes.
I'm just speaking as an independent.
Oh, there you are. You see, when politicians leave politics, then they're independent.
Joseph, one more here in the back.
And the last one, please. We'll go back to you and to Sandra.
Yeah, thank you. Alvaro Cerame from European Junior Doctors. I just wanted to mention that in order to attain universal health coverage and to be able to give the citizens the health coverage they need, we need to remember also that we are healthcare workers. We are still in a dire situation after the pandemic. We believe that some reforms have been made, but we still need a long way to do. And
what do you want from the European Union? Don't tell us the problems you have, because we know them and empathize.
Well, we will
what
like
do you want
to
from
be
the
in the
European
top political priority.
Political priority.
Okay. And some investment wouldn't be that bad.
Investment would be nice.
Thank you.
Okay, Matthias, you take back as speaker now. Colleagues, Martin, I disagree with you. This year in Gastein, I know it's time to finish. Don't remind me of the time. Martin, listen to me. Martin, this year Gastein didn't react like niches and professional pressure groups. I felt that in these priorities, and what I heard was really understanding of the broad European Health Union. If you want to say one 30 seconds each, but I'll end with Sandra on what you heard, 30 seconds each, and we'll end with Matthias and Sandra. I will start with you, Martin.
So what was the question again?
30 seconds if you want to say something.
No, I'm fine because the time's running out.
All my life I had to debate with Martin, you know,
I've spent my life trying to keep him to time. It's impossible.
It's a topic that has not been mentioned here, which I just want to flag up in the final 30 seconds, is food. I'm really concerned about raising obesity levels and overweight among children, and I think the next commissioner should be Commissioner of Health and Food. Not only health and food safety, but work on these nutritional profiles of the European Beating Cancer Plan prevention pillar, work on sustainable and healthy food systems. It's again health and all policies, but food and all policies, and I feel that's really an important topic for the future.
And really here you made major strides. Some of your legislation is absolutely on the environment, on the various products we throw in the food. So the work of SANTE and Consumer Affairs has been fundamental. Juan, your 30 seconds of glory within the time of Martin.
Thank you, Martin. So we might agree more or less between generations every year when we do these kind of exercises, but I just want to say we should keep doing this as we're doing here at the HFG, listening to the next generation, and we will follow that as well when it's our role to do that and listen to the next generation.
I think we're listening very much to you. It's our only hope. Luis.
I'm going to use 10 seconds of my 30 seconds to say exactly the same thing as Juan. Listening to young people is important. We are the future, so thanks for involving us, and we look forward to being involved in the future as well.
Thank you for allowing us to speak at our age. Matthias.
About you, but I have to say I'm very much encouraged by the launch of this debate. Also, like yesterday, you know, when I felt all this enthusiasm in the room, you know, the engagement that people really wanted to think about the priorities. What can we ask, you know, and how can we actually also contribute? And also today, it was not one-way communication. We got a lot of input from the people, very focused, very small sometimes, very specific. Of course, sometimes very stakeholder interested, but it was communication about our European Union. You know, it was like we were creating a little bit of ownership in this debate for the next Commission, the next Parliament, the next iteration of the European Health Union. So basically, this is the side which really encouraged me, but at the same time, I'm looking at Nicole, because Nicole and me, we will organize parts of this debate. I'm also a little bit worried, because we see, you know, how many things are coming at us, you know, and probably some of the debates we are going to organize will be very much populated. There will be plenty of people joining us, which is good. At the same time, you know, our analytical capacity will probably come to its limits. But I'm looking forward to it, and I hope to see you all engaging in this debate. And Sandra, the last words to finish this session, the launch, please, over you.
Honored and humbled. If I may, I will stick with the big things. Demographics, we cannot forget that. We are in a certain shape and not in another shape. We have a lot of expectations and we need to listen carefully, but we need the data. And I fully agree with you, it's any data. We need to have the right data. So finally, I want to repeat to you a concept that is very dear to my heart. We are the EU. It belongs to us to choose our future. I am not political, so I think citizens have the power in Europe. We can do what we really aspire to. We have a very good base to start with in health, but we should watch not to create by dint of, I would say, an excessive hunger in terms of time, a divide between Eastern, Western Europe, between rich and poor, between the different regions of the countries. The time is ticking on climate. The time is ticking on the demographics. We need more sustainable systems that preserve the equity. I like the one who said affordability. Yes, affordability. It's not fair that not only for rare diseases, but because a medicine is too expensive, a member state cannot have it, or a member state only gets the medicine 9 years later, or never gets the medicine. So let me say, this is the EU. So keep the dream floating. Unfortunately, the treaty is what it is, but fortunately, the people around me are fully committed to make the EU also in this field, which is quite an important one for us citizens. I mean, without health, what are we? Thank you.
Thank you. Thank you. Thank you very much, Sandra. Sorry to put you in the hot seat. I know some things you couldn't answer, but I know you enjoyed them. Watch this process. Look at the back for all these papers we're putting on the road. We are counting on you to come back to follow this debate. I felt it's been a positive, it's been constructive, and it's been optimistic. I'm so tired of year after year moaning. Yes, this year we have not been moaning. We see a future, Sandra, and a lot moaning and not moaning and looking forward with real possibilities. And a lot has to do. I'm not a flattering man, but I like to say a lot has to do with your leadership, Sandra. So thank you very much to you, to the young Gasteyners, to my good colleagues, and for Martin, only 3 minutes Gasteyn standard time late. Thank you very much all.